one of the things that we've introduced at UCLH is something called the S-split PLGF ratio. And this is a blood test that got a lot of traction in the press over the past couple of years. And women ask about this test, and it's a diagnostic test that can help in the diagnosis of preeclampsia, but not only help in the diagnosis of preeclampsia, but also help plan the remainder of the pregnancy when you have preeclampsia. We've had the test running at UCLH for about a year now, and we've audited and assessed our test results. And this is something that I presented last year at the FMU annual meeting. And the test is doing exactly what we want the test to do, which is to discriminate those with likely severe preeclampsia from those with more mild disease. So if you have a high S-split PLGF ratio, that means that you're destined to deliver quickly. If you've got a very low ratio, below 38, then you can be very relaxed about those pregnancies. You might get them back less frequently, and those pregnancies are much less high risk around placental dysfunction. So this test is really useful in counselling women and planning surveillance for the remainder of their pregnancies. And I think it's increasingly a test that women are going to ask for if their pregnancies are complicated by preeclampsia or the suspicion of preeclampsia or hypertensive disorders generally. So that's a bit about the S-split PLGF ratio that we successfully introduced at UCLH. And the other thing that it's good that Diane's here, because she's been absolutely instrumental in introducing this in our unit, is first trimester, individualized first trimester screening for preeclampsia. As you may know, across the NHS, the national standard is to use maternal characteristics to screen for the likelihood of preeclampsia. And that's a very sort of broad brush and crude approach. So you look at maternal age, you look at maternal BMI, you look at the maternal history about whether they've had previous preeclampsia, and on the basis of those very sort of broad criteria, you might prescribe aspirin or not. But there's a better way of doing it with better results, which looks at uterine artery Dopplers, which looks at booking blood pressure. And by using those parameters, you can more accurately assess the true risk of that woman having preeclampsia in the second half of her pregnancy, and therefore take a more targeted approach to the prescription of aspirin from early, and you get better results. And this is data from another unit in South London, St George's, where they've introduced this enhanced screening test for preeclampsia, and you can see that the grey bars are after the introduction of this individualised first trimester screening. You've got much lower rates of preeclampsia with better prescription of aspirin and actually better compliance from patients in terms of taking aspirin when you use the Fetal Medicine Foundation approach. So that's something that we've introduced at UCLH since February, and I think it's a huge advance and a huge improvement.